Good afternoon, everyone. Thank you for being here. Thanks for joining us today. Of course, Dr. Kara Christ on my right, who leads the Arizona Department of Health Services. Major General Mick McGuire on my left, who is the Adjutant General of the National Guard and leading up efforts for the Department of Emergency Management and coordinating with FEMA and our federal partners. I want to begin by thanking the citizens of Arizona for their hard work, their responsible behavior. We announced the Stay Home, Stay Healthy, Stay Connected order on March 30th, and it's been an incredible couple of months in the state of Arizona. We are making some progress. We want to share with you the data that we have, where we are today, the information that we're looking at, the guidance that we're receiving from our federal partners, and what is possible in the future. You probably notice on the slide, not only does it say stay home, stay healthy, stay connected, it also says return stronger. And that's going to be part of the objective and the theme that we talk about here. So I want to begin with thanking our federal partners. We get a video teleconference once or twice a week with President Trump, Vice President Pence, Dr. Deborah Birx, Dr. Anthony Fauci, Secretary Mnuchin, Secretary Azar, of course Dr. Christ and General McGuire are always on those calls. Part of where we are today is as a result of that federal guidance that began as 15 days to slow the spread and then turned into 30 days to slow the spread. That turned into what we have today is the guidance around the stay home, stay healthy, stay connected order until April 30th. What you see in front of you here right now is the White House guidance going forward. A lot of verbiage on this slide. This is a public document. Anybody that wants this document can go to Opening Up America Again. Just search that on Google. We'll post it on azhealth.gov, and all these things will be at arizonaconnected.org as well. But what's important here is really the White House proposes state or regional gating criteria, and I think it's the line underneath that I want to highlight. There's flexibility for states to tailor application of these criteria to whatever the local circumstances are. You know, my focus has been 100% on the state of Arizona. Our circumstances are different than other states, and we're going to use this combination of symptoms, cases, and hospitals to make decisions going forward. And I really appreciate the flexibility that our federal partners gave in presenting this guidance forward. So our approach going forward will be phased. It'll be based on up-to-date data and readiness. It will mitigate the risk of resurgence. We have come a long way in a short period of time as a state. It's been by no lack of sacrifice or effort from our citizens, and we do not want to lose that ground as we begin to make additional decisions going forward. We're going to want to protect the most vulnerable here. The federal document defines the most vulnerable, and they are people that we love the most in our lives. I've talked a little bit about my 96-year-old grandmother, who's an Arizonan, and my mom. She would be mad if I gave her age. I've said that before. But my 96-year-old grandmother had her at a very young age. They are among the most vulnerable, and those are the ones that we're going to want to protect continually going forward, regardless of what we're able to do with our economy. And we're going to implement this on a statewide or county-by-county basis. This is at the governor's discretion. Of course, my preference is to do things statewide. We do have the option to do things county by county as we have the proper information. So these are guidelines that normally Dr. Chris talks about, but these are the guidelines that have come from the federal government. These are the guidelines that'll be across all 50 states, and they make a difference for all individuals. So I want to touch on them myself. First, this idea of just practicing good hygiene. Washing your hands, soap and water, hand sanitizer, especially after touching frequently used items or surfaces. Avoid touching your face. Who would have ever thought this would be so hard? Every time Dr. Christa said this, my face has begun to itch, but avoiding that can go a long way to slowing and stopping the spread. Of course, good personal hygiene when sneezing or coughing into a tissue or inside your elbow. We talked on disinfecting things, and then strongly considering using face coverings while in public, and particularly when using mass transit. Secondly, people who feel sick should stay home. Anybody that grew up in America that's my age or older, this is different. You used to prove your work ethic by just showing up and coming to work regardless of the circumstances. That's not a good idea in the age of COVID-19. It probably wasn't a good idea before that. So if you're sick, stay home, don't go to school. I'm blessed with a very hardworking and talented senior staff in the governor's office who have been able to stay healthy through this entire COVID-19 dilemma. We did have one very valuable individual who had a persistent cough. She made the decision to go home, and it was the right decision. She was able to work from home. Thank goodness she didn't contract COVID-19, but that's the right decision. So if you're sick, stay home, and it will make a big difference. So let's talk about where we are today. And when I say we, I'm talking about the state of Arizona. That's the focus. We're talking about public health first, making sure that we're protecting our citizens and what our status is. So this is a busy slide and a new one for most of you to see for the first time. What you're looking at are COVID-19 cases by day. On the far right of the slide, you see we had the first case of COVID-19 in Arizona on January 26th, okay? On March 11th, we had enough information to make a public health emergency declaration. What's important is the day after that first case, Dr. Kara Christ actually stood up an emergency operations center at the Department of Health Services. And you can see the decisions that have been made and the cases that have happened over the course of time. Schools have closed, dining restaurants have closed, the stay-home order. And then you can see where we were in the last 4 to 7 days. We'll fill that in as we get the information. The takeaway on this chart would be if you're looking for a trend, there isn't one on this chart. There's a lot of information and data, but it's changing and it's dynamic. We're going to continue to watch this curve. We're going to zero in on the data related to syndromic surveillance. This is what reflects the percentage of people who are hospitalized or visit an emergency department with COVID-like citizens. And we also want to have a handle on the health of our healthcare system and the impacts that COVID-19 has on our hospital capacity. Now this chart shows you COVID-like illness surveillance in Arizona and influenza-like illness surveillance. That's traditional flu-like surveillance. COVID is the gold line. The influenza is the blue line. You can see from December 29th forward, they somewhat track and mirror each other. What we look for are trends and data in which we can make some decisions on or show that we're making some progress. If you look at the date of the stay-home order on March 31st, and then you look at the reduction in the COVID-like illness surveillance and the influenza illness-like surveillance, that's positive. Now that's only a week or two, but it's a difference and it's a change and it tracks together. And if you're curious, the COVID-like illness is a fever, a cough, and shortness of breath. Influenza, to differentiate, is a fever, a cough, and a sore throat. So if you remember, we began talking about how you avoid contracting this. And we still, if you haven't contracted COVID-19 yet, we don't want you to contract it. And your decisions can weigh on what happens there. If you were to contract it, the question was, is Arizona ready? We saw what was happening in other parts of the country and other parts of the world. We didn't know when the surge was going to come. And if you did contract COVID-19, could we care for you? Could we provide the comfort? On this slide, a lot of information, but the gray represents inpatient hospital beds available in Arizona. The blue represents inpatient beds in use. And the orange represents inpatient beds used for COVID-19 patients. The takeaway on this slide, we have capacity. We have hospital capacity in Arizona. And as you can see, COVID-19 cases occupy just a small portion of capacity available of our hospital beds, less than 10%. This is good news, and it shows we're prepared in Arizona. Now next, if you contract this and you're very sick, you're very ill, you need what are ICU beds, that's intensive care hospital beds. The takeaway from this slide, we have capacity. The gray represents available, the blue represents ICU beds that are in use at this time, and the orange represents the ICU beds with COVID patients. And they occupy less than 20% of the total ICU beds. Again, the takeaway here, Arizona is prepared. Next, ventilators. You remember, ventilators were a big discussion. There was an apparent shortage of ventilators all across the country. Arizona got to work to not only figure out how many ventilators we had in the state, how many we could find, and how many we could acquire. Gray represents the number of ventilators available in our state. Blue shows the ventilators currently in use, and orange shows the ventilators used by COVID-19 patients. This ventilator support, if you do contract COVID-19, is critical if you need it. We've also been able to, where necessary, surge ventilators or access ventilators that were needed. If there's a hot spot in Arizona, it was on the Navajo Nation. Major General Mick McGuire, the Army Corps of Engineers, and the National Guard surged emergency medical personnel. President Trump, with the advocacy of Senator Martha McSally, took a personal interest in what was happening there and was able to get us an additional 100 ventilators for the Navajo Nation. So again, takeaway here, we're prepared with the amount of ventilators. So things have changed a lot in the last 45 days. Our insight into hospital capacity then was limited. Today, we have daily mandatory reporting through enhanced surveillance. ICU beds then was at 1,532. Today, we have 1,668 plus 485 additional beds available as needed. 45 days ago, we were aware of 330 ventilators in the state of Arizona. Today, we have 1,684 plus $10 million in-state issued grants for additional capacity. So we're making progress. Looking back, there were a lot of unknowns. There's still unknowns in front of us. But we know much more. We can make the right information. And again, the priority here is to protect public health. Let's touch on some of the decisions that we've had to make in Arizona. I want to point out what's closed inside our state. And I want to say before we tick through the list, we made these orders. These closings happened in an effort to slow the spread of this virus. It was to protect public health. None of these decisions were easy. I was not eager to make any of these decisions. I've actually used the word reluctant around this, but I'm confident each one of these decisions was the right decision at the right time, given where we were in terms of the curve, the numbers we were seeing across the country, and what was unknown. So our schools have closed, our universities have closed, our restaurants have closed. Of course, they're available for dine-in or takeout, and I encourage that. Our bars, gyms, movie theaters, barber shops, elective surgeries have been closed or shut down. Salons, spas, concerts, spring training was canceled. No large venue gatherings. No college sports. There's been no Major League Baseball to date. Of course, casinos are closed. The NBA season was stopped. Large gatherings for weddings are not happening. Large outdoor events. Small businesses, by and large, have been closed. Most retail, and there's been a limited closing of our daycares as well. So in January, I like to brag a lot in Arizona about the bright light that our economy was. Arizona was leading the nation in economic growth, development, and momentum. This pandemic, COVID-19, has done so much around these decisions to dim our economy in the state of Arizona. Now, I hear the calls that are out there from people that say, turn it back on, as if it were a light switch. I want you to know these decisions were not made in one fell swoop. They were made over the course of time. And the result has been this dramatic slowdown or decrease in economic activity. So how I'd like to present it is like a dimmer switch that was at the highest possible level in January through mid-February, and COVID-19 has severely dimmed what's happening today in Arizona. And as appropriate, with the protection of public health first, we're going to talk about how we increase the energy in our economy. Another thing I want to point out that has been good to slow the spread of the virus is that more employees are teleworking. More employees are working from home, including state government. It's no different. We've got a third of our employees that are working from home. But this has also affected our economy. People aren't getting in their car. They're not buying gas. They're not going out for lunch, et cetera, et cetera, et cetera. So this has also gone to slow the spread and to dim the economic light. So let's talk about what's best and what's next for Arizona. Our decisions to date have been what I've called calm and steady, with a sense of urgency, a focus on protecting public health first and foremost. We've talked about things that we need and need more of, like testing. We want to make sure that our healthcare system is strong, and we want to make sure we have the proper data and information in which to make decisions so that we can control the growth of this virus. So today, I do have an announcement. It will be a slight tick up on the dimmer switch for our economy. Elective surgery was something that was stopped in Arizona by executive order. Last week, our hospitals asked for authorization to resume elective surgeries. So today I'm issuing an executive order authorizing hospitals and outpatient surgical centers who can demonstrate adequate capacity to resume elective surgeries beginning May 1st. Now, I just want to visit that for 1 second. If you remember, before the discussion was around ventilators, the discussion was around PPE. That's personal protective equipment. The concern was there wasn't enough for our healthcare workers, our doctors, nurses, emergency medical responders, people that are providing tests, correctional officers, etc. Today I'm looking out, I see many of you in some personal protective equipment. Our hospitals and healthcare experts have told us they've acquired adequate supplies, so those elective surgeries that have been delayed or those outpatient surgical centers that can demonstrate capacity can open again May 1st. That's a good news. Next, ramping up testing in Arizona. Testing, something we talk about. I'm on a conference call every week with fellow governors. I just got off one. I think nearly every governor in the country, including Andrew Cuomo, was on it. Everyone in the nation needs more testing, including Arizona. I want to separate this out and try to simplify it because I think the testing can be confusing. Diagnostic testing. This is the testing that tells you if you're sick today. It's the testing we've been talking about mostly throughout the crisis. To date, we've conducted 56,601 tests in Arizona. We're going to expand this testing. We're going to be able to test broader populations. We focused on first responders, the most vulnerable, and those that are symptomatic. I know there's many people that want this test. We plan to expand it. All that test tells you is if you're sick today. I could take that test today. I could be told that I do not have COVID-19. I could walk out, touch the wrong surface, and contract the virus. I wouldn't necessarily know if I had it unless I was tested again. We still need more of those tests. Those are diagnostic tests. The next tests are antibody tests, sometimes also called serology tests. I'm going to call them antibody tests because we had Dr. Bobby Robbins of the University of Arizona. He's not only a medical doctor and the university president, he's a trained cardiothoracic surgeon from Stanford Medical who ran the Texas Medical Center. He and his researchers at U of A are going to put together 250,000 antibody tests available for Arizonans. We have plans to ramp that up even more. 250,000 is a significant sample that we'll be able to get out to citizens. Dr. Robbins is going to do the first test. That test will tell you if you've contracted COVID-19 and since recovered. I don't know how many of you have been sick this calendar year or late last year, but it's possible. I talked about my own wife, Angela, my middle son, Joe, my mom. All have been down with what we thought was the flu. When this test comes out, we'll know if they contracted COVID-19, and we'll also be able to hear from the medical professionals on what that means for immunity going forward. Additional news on testing. Our supply chain is starting to catch up. Our private sector providers are coming and answering the call. Sonora Quest announces more COVID-19 testing. We have a partnership with them to announce more antibody testing that will tell you, again, in addition to the 250,000 tests we'll have from the U of A, 1,000 to 3,000 additional tests per day at launch with plans to ramp up. So let's talk about what's next, what the picture looks like for Arizona going forward, the framework that we're going to use to make decisions, and what those decision points and dates will look like. Again, each decision is going to be guided by public health first and foremost. They are going to be step by step and incremental. They'll be gradual, and they will be responsible as we restore confidence in our economy at the appropriate and safe time in Arizona. We do not want to lose the ground that we have gained. I want to get back to where we were as much as anybody in the state, but I want to do it in a safe and healthy way. Many people are talking about a new normal or a return to normalcy. I want to say as we go in this direction, I believe that we're going to see a temporary normal. And that's going to be as we balance public health, make sure that we can take care of the most vulnerable, we have the appropriate supplies and hospital capacities, but also make additional decisions in addition to elective surgery that you will see a difference in our economy. You'll see increased sanitation techniques. You'll see things that are done to provide you comfort as a consumer inside organizations. And that will all be in the future. And that will be different than what you've seen in the past. What we don't want to do is make decisions too early and be in a position where we have to come back and reverse a decision. To date, we've been able to head in one direction in protecting public health. Today, you see the first step in a direction of protecting public health, but allowing something that was stopped by executive order. It's going to be important that we focus on the fundamentals that allowed us to get to a position where Arizona today has its arms around this virus. It's prepared for what comes next. So please keep doing what you're doing, because you're doing a great job. This physical distancing, continuing it. This protection of our most vulnerable, those that are defined as elderly, and especially those that are elderly with an underlying health condition. We're going to develop Arizona solutions. We're going to use the Arizona data that we have, and I'm going to get input and support from Arizona stakeholders as we do this. When we headed into this pandemic, our state was the strongest state economically in the nation. If we do this right, and we do it responsibly and properly, we can be the strongest state in the nation leading out of this pandemic. And I believe not only can we lift that dimmer switch to where it was, but it can be brighter in Arizona than it has ever been before. To do that, I'm asking for some patience, continued cooperation, and partnership. The stay home, stay healthy, stay connected order was declared on March 30th. It went into effect on March 31st, and it expires on April 30th, 2020, unless extended. Now, it's not lost on me that today is April 22nd, and that the 27th will be on Monday, and that next Friday is May 1st. So we're going to be visiting next week as we make decisions. There are three options around this executive order right now. The first is to let it expire. The second is to extend it in its current form, and the third is to modify it with changes and improvements that reflect the situation on the ground. So if you're looking for a headline today, that headline would be elective surgeries have resumed in Arizona effective May 1st. The stay-at-home order is still in effect. More to follow. Dr. Christ?
Thank you, Governor. So just to run through the data slides really quick, or just the one. Today's cases were at 5459. We've run over 56,000 tests. We have cases in all 15 counties, and there have been 229 deaths statewide. We will continue to update our data, our dashboard, and continue to add additional information as we get it. Thank you, Governor.
Doctor. And for an update on Navajo Nation, Major General McGuire.
Thank you, Governor. We were able in the last week to receive assistance from the federal government for disaster and military assistance teams for the federal medical stations at Chinle and over in Shiprock. As well, I want to thank FEMA and FEMA Region 9 for deploying a federal coordinating officer and an incident management team to Window Rock to manage that situation, as well as I moved Brigadier General Andrew McDonald forward as a Task Force Arizona lead to coordinate with the states of Utah, New Mexico, and obviously synchronizing all of the activities of our great Arizona Guardsmen and other corporate partners and community partners and government partners that have helped us out. So thank you.
Thanks so much, General, for the effort of the National Guard and what we've been able to do for Navajo Nation. Let's open it up to some questions. Patrick?
We'll start with Howie.
Hi, Howie.
Hello, Governor. Someday I want to see you wearing a mask. We'll talk about that later. I appreciate your slide. You're telling us the headline is about the outpatient surgery and the May 1st deadline. But it seems to me, given the numbers that we've seen, that the doctor just talked about, we had 21 deaths reported today, 21 deaths yesterday. We've tested 0.7% of Arizona. Is there any way at all that you could actually lift your orders, business orders, your stay-at-home orders on May 1st?
So let me address this because we're going to share with you continually what we know. Anybody that's been to the azhealth.gov website in the last several days sees the increased amount of data and information and current trends that we are able to share with you. So we're going to continue to do that. It's just premature, and I know I get asked a lot, when are we going to come out of this? What's going to happen on this date? I've tried to be as candid and direct as I can be in what I know today. Today, the good news is elective surgery is going to resume in Arizona. That's a positive next step in lifting that dimmer, but I don't want to guess on any of this. We haven't guessed to date, so we're going to follow information and data, but I also want to say let's not reset the goalposts in terms of what the objectives were. When we announced these closings, when these decisions were being made, it was to slow the spread, to make sure that we had enough PPE if there were a surge, to make sure that if someone were dramatically sick and required hospitalization, that we could comfort and care for them. If they needed a ventilator, could we do that? If we had a hot spot, how would we deal with that? Many of those questions have been answered, and Arizona is in a much better decision today. Of course, there's a lot that we don't know going into the future, but in terms of the decisions that we're going to make, like I said, it's not going to be that light switch. You saw the decisions that were made along the way, incrementally and step by step. As we have confidence and we have information and we have guidelines that we can put out, we'll make the appropriate decisions.
Let me ask the other half of it. How the decisions separately for the various businesses at various times. All of us here have heard from small businesses. They see people going into Walmart. They see people going into Home Depot. They see people going into Target. They see people gathered at the Capitol. So they're wondering, when are you going to finally do something for small business, which they say they're in a better position to exercise that social distancing. They shouldn't have to play games like the jewelry shop owner in Winslow, not bringing 4 rolls of paper towel. When are you going to do something?
Well, first I want to say, Howie, that's where I came from. I mean, before I ran for office, I was a small business owner. And it was a very difficult decision to make so many of the decisions around these small businesses. I've mentioned that I was reluctant at each turn. I'm not going to exercise all the authority that's given under a declaration of emergency just because it's possible. I wanted to make the right, most responsible decision, and I'm eager to do that when it's the right thing to do. The guidance that we've put out is through April 30th. The only exception to that guidance today is I'm announcing that elective surgeries are going to resume on May 1st. You could say that's within the guidance, but regardless of the statistics we have, we know that we can do that, and that's the decision set for today.
We'll go to Dennis and then Nicole.
I just want to follow up on Howie's question, given the fact that Dr. Chris's projections are going to be May. How is it possible that you couldn't lift these restrictions on May 1st unless it's political effect?
Projections. The question is around projections. And I want Dr. Chris to address these projections and how these projections have changed over the course of time, and then how we can make decisions in that changing environment.
Thank you. So as we look at the projections, they're mathematical models that hopefully predict where we'll be. As we've made those mitigation strategies, we have been evaluating what those changes have caused the projections to do. So as we've slowed the spread, they've pushed them out. They are very sensitive to mitigation strategies, as well as different factors that are included into each model. So while we've been using them to predict what our resources will be and the resources needed for that, they are just that. They are just models, and we will continue to use the real data to make the on-the-ground decisions.
And these models have changed so dramatically over the course of time. Again, I want to give the credit to the people that have made the sacrifices over the last 45 days, to the citizens of Arizona that have behaved so responsibly with so much common sense. Because right now, of course, whenever you lose a life, whenever you have a contraction of COVID-19, that's something we have to address and deal with. But what we've been able to do in the slowing of this spread, especially in comparison to other places that were hit first or hit harder, we're in a very positive spot to begin to think about additional decisions to increase the light in our economy.
Yeah, and I appreciate the explaining the model, but you do
So again, I want to answer your question and say, remember what the objective has been to date, okay? We want to reduce the number of deaths by as many as we can. We want to reduce the number of illnesses by as many as we can. Part of the concern was there capacity? Were there supplies? Were there ventilators? Well, we know that we have our arms around that part of it, and today we do. So we're going to work with the CDC and their guidance with, Dr. Christ as my right hand on the public health decisions. I believe we will be in a position to make decisions. Those decisions aren't to be made today, beyond elective surgery.
Governor, we're not getting daily or near daily briefings from you. It's like you're not communicating with the public.
We're going to over-communicate, Nicole. We're going to continue to over-communicate. When I've got information, I'm going to give you information. Dr. Christ posts every morning at 9 a.m. azhealth.gov the statistics and results that we have. I haven't come out to do...
It's been 8 days. We're just learning you're canceling the weekly phone calls with mayors here on out. Who are you communicating with?
Nicole...
If you're not talking to the public, if you're not talking to mayors, how is anyone going to know your plan? And on their questions, on that front, what is the plan? We're not hearing a roadmap. How do we get to phase one? What are you looking for? And what is the plan?
Okay.
That's 8 days from now.
Thank you, Nicole. Appreciate the question. We're communicating. We're going to continue to communicate. As we have information and data that is changing besides the daily tracking, we're going to come out here in front of you. We've showed you where we are. We've showed you what's going to happen between now and May 1st. And we've also showed you the gating criteria which is going to be the guidelines that will help guide our decision-making.
Why would you wait till next week? People's lives and livelihoods are on the line to start giving people a heads up. You have businesses seeking guidance. You have people wondering if they're going to get paychecks, when they can get back to work. You're not giving a clear roadmap as to what phase one is going to look like.
Well, I've showed you what has been closed. Among what was closed was elective surgery. Today, that's been reopened. We've got a better handle on public health. And as we have that information, that data, we'll continue to share it. If something changes between now and next week, we'll be right here.
So we're not reopening on May.
We're going to go to JJ with AP, please.
We're not opening on May 1st. Can you just?
I think the question's been asked several times and answered several times.
JJ, and staffing, please. Nicole Geigel, thank you.
Dr. Chris, what role does testing and contact tracing play in
So that's a really great question, and we are currently working with our county health departments. So just as you described, our county health departments are our boots on the ground, and they conduct the contact tracing and are helping us to ramp up our testing, because that is an important component of it. We will be identifying technological resources as well as additional staffing resources and funding for our county health departments, as well as putting together a statewide contact tracing plan, because it is so important.
So, of course, we're measuring across the board, and we're going to share the measurements that we're looking at with you. Many of them today now are on asdhealth.gov. The guidelines are flexible, so governors can make whatever decisions they deem appropriate and responsible. And we're going to let those guidelines, of course, we're paying attention to them, but we're also looking at the Arizona-specific data and what we know. And I think an example of the flexibility that we're exercising right now is on elective surgery. We've got information. We've been focused on the PPE component of this for some time. We've been in acquisition mode. We've probably been stockpiling this. The same healthcare providers that were asking us to stop elective surgery are now coming back and saying, please restart it. This is outside of any strict guideline. This is within the flexible guideline, and it's a decision we're confident making.
So do you want to see the state reach those numbers, those criteria that are laid out before you actually work?
I'm going to look at the state numbers. I'm going to look at the trends, and I'm going to be guided by public health concerns and working in coordination with Dr. Christ.
Go ahead, Stephanie.
So Arizona ranks one of the worst in the country in terms of per capita public health spending. So now that you want to return stronger, do you think moving forward you will be giving more support or money to the Arizona Department of Health?
Well, the one thing I want to say is Arizona's in a much different position today than it was in the last recession. If you recall, once the economy fell off a cliff in 08 and 09, there was a $3 billion deficit. There was actually a temporary tax that served for some time and then went away. This year, we had the largest budget that was presented in the history of the state in January. Not only did we have the highest balance in our general fund, of course we've got $1 billion balance in the rainy day fund, and there was going to be additional expenditures for the Department of Health Services in that funding. So yeah, as the state comes back up brighter and stronger and our economy revives, we'll be in a position to make targeted investments that benefit the people of Arizona. I look forward to that day. Today, we're still navigating COVID-19. We're still navigating what's happening inside this economic situation that's been caused by it, and that's going to be part of that step-by-step process.
We're going to go to one of our Zoom
you have any thoughts on that plan and what kind of legislation, if any, do you think the legislation should take care of before they go home for the year?
Well, I want to first say thank you to the legislature and legislative leadership. They've been partners in this, in being supportive. I've always respected the legislature as a co-equal branch and treated them as such. They've returned that by being so responsible around the budget in terms of a baseline that we were able to pass this year. If legislative leadership thinks there's things that need to be addressed, of course, I'm open-minded to that. I would just ask them when they come back to socially distance and wash their hands and cover their coughs.
Is there any specific legislation you'd like to see taken care of?
I'm focused 100% right now on public health and then what we're going to do to return our economy to where it was. There's no other priority that I have right now.
Thank you, Jerry. We're going to go to one more from the board. Brian Webb from Fox 10. Go ahead, Brian.
Hi, Governor.
Hi, Brian. Go ahead, Brian.
Looks like we may have lost Brian, so you can try and come back there. Let's go back to the room here. Brandon?
Thank you. Governor, these cases are spreading like wildfire through nursing homes. What are you doing to protect the residents there? And when will you tell us which nursing homes are affected? It's really hard to read in the news of 12 cases, 20 cases here. People need to know.
So this is my top concern. When I talk about public health and priorities, it is these nursing homes and long-term care. This was the first executive order that we put forward so that people could be stopped from visiting inside the nursing homes, increased sanitation, et cetera. My grandmother lives in one of these long-term care facilities. I want every Arizonans to have the same care and protection that she has, and she has the same, of course, risks. Although I'm able to talk to her on the phone, and so is the rest of my family, none of us have been able to visit face-to-face with her. No matter what happens as we go forward here, it is going to be these long-term care facilities, and this is the definition of vulnerable as how we understand it, and along with the federal guidance of the people that need the protections. We want to also protect not only public health, but public privacy. So I want everyone to know that if you have a loved one in one of these nursing homes and they contract COVID-19, you will be notified immediately of that fact. In terms of making this information public, in terms of what you're seeing some of the other states doing, that's something that Dr. Christ and I have talked about, and she's going to talk about the guideline that we'll have for making that information public going forward. Doctor?
So we want to make sure that we're protecting the public health and that we're not releasing protected health information on an individual that could allow somebody else to identify who that individual is in the facility. So we will continue to work on outbreaks and posting the types of facilities that have outbreaks or positive cases in them. But until we feel that there are enough individuals to be de-identified, we will be continuing to hold the names.
It sounds like you're protecting the facilities over the larger public. There are no HIPAA laws that apply here.
So we
to the
are.
facilities.
So we are working with the facilities so that they can notify the direct residents and their families who are impacted.
Why don't people in the larger community deserve to know? I might want to bring my mother or father to one of these facilities.
And there are rules right now that are going through CMS that will require them to let individuals know about potential cases of communicable disease within those.
I haven't heard a good explanation for why the larger community deserves to find out in a way that's just not in the newspaper or online.
And that it is protected health information, and so.
We're going to go to,
I got some
you've asked
senior
a question
citizen
for us.
advocate who knows the laws very well, texting me right now, and she's right, there are no, what are the laws protecting?
Well, I'm going to defer to Dr. Christ on this. Thank you.
We're going to go to Craig and then Melissa.
Governor, thanks for having this press conference today. Kirk Adams has been hired by private businesses to represent them against the state. He still works for you as an unpaid
Kirk Adams is someone of the highest personal integrity and character, and someone who I'm certain also follows the law.
Melissa, go ahead.
Dr. Chris, we have repeatedly asked for the full model that ADHS is using internally, in particular the model using universities here locally. Today you're sharing the conclusions of some of these models, but not the inputs or methodology or the entirety of the projections. Can you please fill us in on those specific aspects now, especially on the local model that you guys have asked universities to prepare for you?
So the models are what we received from the universities, which is the final presentation, is posted on the web. And so you can download those. You'd have to go to the universities to get the actual models, like the equations for that.
So the universities have told us that you guys are the possessor of the public records. You've got the full records that you've received from them online?
I've got the presentation that I've seen. I don't know what else we've received.
And Melissa, if you dig into some of these models, the IMHE model shows you all the criteria that they look at. The model changes wildly day to day. A model that we've been looking at and we have found accurate in terms of inventory and supplies for the state of Arizona has been the FEMA model that is worked in partnership with Johns Hopkins University, and all of the criteria is on the first page of the model.
But you guys aren't releasing the FEMA model specifically for
We have asked permission to release the FEMA model. We haven't gotten it yet, but we have it ready to post once we get permission.
About this local university model, it says that we're going to hit the peak on May 22nd with 300 ICU beds and 600 hospitalizations, but we're at those numbers today. So does it plateau between here and May 22nd?
According to the model, which is really difficult because it's just a mathematical calculation. And so likely plateau as we continue to go, but it's very hard to determine what's going to happen if you have like a special condition in a community.
And is that based upon continuing the social distancing measures that are in the executive order, or is that including a list of some social distancing?
So some of the scenarios that they put into that do take into account not continuing mitigation. Some of them do take into mitigation, and then they've taken the midpoint of that as the May 22nd model.
I think also part of the real fear and concern and anxiety around those models were where the numbers were. I didn't screenshot those numbers, but I saw the same information that you saw. I also know what I was talking to Dr. Kara Christ about at the time. But those numbers have changed dramatically, and I would say they've changed dramatically for the better in Arizona, showing us as not only prepared but a much lower contraction, much fewer fatalities, et cetera, et cetera, et cetera. But also, over the course of time, when you see those models changing willy-nilly like that, what hasn't changed is what we know about our hospital capacity, what we know about our supply of equipment, well, the handle we have on ventilators. So regardless of which one of these models happens to be right, we're prepared.
We're going to go to AP. We have time for just a few more.
Dr. Chris, speaking of the model, you wrote a blog post this morning kind of laying out what the model is showing, and in it you said that the FEMA model you guys find the most reliable. I don't remember the specific version, but what is it about that model that does seem like it's the best? And does that model, I mean, it's sort of the rosiest of the models, did that outcome take into account the fact that we had the most deaths 2 days in the past 2 days, or when was it last updated?
So the model that we have was last updated last week. So they say that they're good for about 2 weeks, and then they will recalculate and provide additional information. The FEMA model is a mid-range model, and so it's not the rosiest like the IHME model. The thing that's really good about the model is what they've done is on the 30th of April, they've assumed that all mitigation strategies are lifted, and they give a projection ongoing. So we'll continue to follow that model. We were hoping to be able to get permission to post it.
Tommy, go ahead.
So Howie, I just want to say, you're presenting choices to me that I haven't laid out to you. I've put out what the options are. There are 3 options in front of me right now before April 30th. Those are the options that I'm going to address. We don't know if we're past the peak or before the peak today, yet we were able to make a decision around elective surgery, a decision that's in alignment with public health in the state of Arizona, one we're confident will help a bit economically, and we're going to continue to act in that fashion. Howie, I'm not going to morph into a fortune teller to answer your question. We're going to follow the facts and the data. These are speculations that are educated speculations in terms of this modeling. I would appreciate it if somebody would write the article on how wildly these models have changed, not just in Arizona, all across the country. And what we've been doing here is preparing for the worst if, in fact, it is in front of us and not behind us.
Peter, go ahead, last question.
So, Dr. Chris, are these deaths in the nursing homes labeled as COVID deaths because it's the last diagnosis these poor patients ever had, or how are they being categorized? And if COVID was a disease they contracted, yet they had so many other underlying conditions, and perhaps those underlying conditions took their lives, or made them even more ill, how did they get categorized?
So currently, the individuals who have died that are posted on our website, those are confirmed COVID cases, so they have had a confirmed positive test. We are working with the Centers for Disease Control and Prevention and our medical certifiers for those individuals that may not have been tested, but they suspect or they feel that the death was due to COVID. Those will be captured moving forward as we do death certificate results. But right now, the ones that are captured on our dashboard are only those that have confirmed COVID cases.
Thank you very much. Thank you, everyone. We appreciate the time.
So let me close by just saying thank you all for your questions. If we have new information, if things change, we'll be here, okay? I want to over-communicate. When I have new knowledge, I want our citizens to have that knowledge. Of course, we will continue to post the metrics that everyone's been focusing daily at azhealth.gov. But I, again, want to thank everyone for their cooperation, their partnership. While we are seeing that we're getting a handle on the healthcare crisis, and we're able to make a decision like restoring elective surgery, we don't know what the future is going to hold, so please keep doing what you're doing. The stay home, stay healthy, stay connected order is still in place, and the social distancing, the good practices that we talked about, hand washing, covering your cough, staying home if you're sick, that all makes a difference. I want to thank everybody for their help along the way. Any additional information that you need is at arizonatogether.org. Thanks so much.